Hello, my name is Frank Guerriero. I'm a vascular surgery nurse practitioner who works in South Australia. And I've been invited, and it is an honour to speak to you by the Lindsay Leg Club to have a chat to you about peripheral vascular disease. So I guess we should start with what actually is peripheral vascular disease? It's an interesting term, and look, in all honesty, we're trying to move away from using that term because it can be a bit confusing. A lot of people often mix up the distinction between veins and arteries within the body. So I think first and foremost, it's probably good to cover off on what the difference is between these two vessel structures within the body, because a lot of people use those terms interchangeably. And when we start talking about the nature of the diseases related to them, they're quite distinct and different. So let's have a first chat about the difference between arteries and veins. I'm going to start by talking about arteries. Now, arteries, our circulatory system, is basically like a round sort of circular system of plumbing throughout our body that carries blood away from our heart, which we fundamentally view as a pump, and it stretches out all the way out to our peripheries. It passes by our organs and feeds those, and it carries nutrients and oxygen-rich blood out to our cells, out to our muscles, out to our organs, out to our skin, to keep them all alive and healthy and well. So arteries are really important, and the structure of arteries, because they're connected directly to the pump, are quite thick and muscular because they have to cope with a lot of pressure. Every time our heart squeezes, there's a significantly high volume of pressure that shunts through the system, and our arteries have to be able to cope with that pressure. And they also have the means of adjusting for things like shock or changes in temperature or bursts of adrenaline to help move stuff through our body. So when we're talking about peripheral arteries, we're talking about arteries pretty much anywhere from the bits that come off of your heart all the way out to your extremities, your fingertips and your toes, okay? And everything in between. That's serviced by your peripheral arterial system. Now, when we're talking about veins, there comes this kind of hard to define point at which arteries, as they leave our body and feed our organs, get smaller and smaller and smaller as they fit through all the smaller spaces and eventually reach the very tips of our extremities and become veins. And at that point, the structure of the vessel changes. Veins are thin-walled and the low pressure system. They're like the sewage system of our circulatory system, our plumbing system in our body. So they carry away the wastes and toxins that our cells and our muscles and our organs have used, and they bring them back to the body. So unlike arteries, they do the opposite. They start small and they get bigger and bigger and bigger as they come away from the peripheries and head back to our bodies and bypass our organs. So they take all this toxic waste back through our body, back past our liver and kidneys, which cleanse the blood and the waste that come through there, and eventually we recharge that blood by it passing back through the right side of our heart, and it flows through our lungs and gets recharged, passes through the left side of our heart and returns to the arteries, and so on and so forth. There's one key difference between the structures of veins. Whilst the walls of veins are a lot thinner than they are to arteries because they deal with a lot of pressure, veins also have one-way valves. And the reason that veins have one-way valves is that gravity, when we're standing up or even sitting down, is strong enough that it can actually be higher than the relaxed force of our heart. So to try and translate this to something simple, when our heart relaxes, gravity is actually stronger than the resting pressure that's in our circulatory system, and therefore the blood actually tries to move backwards down towards our feet or down towards the earth because of the strength of gravity. Now, if without these one-way valves shutting off and stopping the blood from flowing in the wrong direction, we would end up with feet and legs that would be full of blood and fluid, but we don't end up with that because of these one-way valves. So every time our heart relaxes, the valves in our veins close and they stop the blood from running in the wrong direction. Now, this will be an important point to come back to in my second podcast, and I'll reiterate the difference again between arteries and veins. So for this podcast, we're just going to focus on peripheral arteries, on peripheral arterial disease, and so we're talking about the high pressure system that feeds the body's organs nutrients, oxygen, blood. So when we're talking about peripheral arterial disease, we're talking about disease of the arterial system, the high pressure hoses. Now, some risk factors of arterial disease are things that can damage the inner lining or damage the health of the arteries, and that includes smoking. You can have a family history of arterial disease. Obesity will contribute to arterial disease, and having high cholesterol will also contribute to arterial disease, as will diabetes. There are a few ways in which peripheral arterial disease can manifest, and I'll talk about these in sort of scale of severity. So let's start with perhaps one of the more lighter symptoms of peripheral arterial disease, or PAD as we call it for short, and that's the concept of claudication, or pain in the legs on exertion. When we run and use our legs and our muscles, we sometimes experience pain build up in them as a result of the matching between the ability for the body to supply blood and oxygen to the body and the build up of wastes being mismatched. And when there's more wastes, i.e. using your muscles so much that you can't clear away the wastes or feed the muscles enough oxygen, so lots of exercise, then we start experiencing pain in the muscles, and that's your body saying, stop, 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 we're actually potentially causing damage here. People that go for walks for short distance that experience that pain, that's abnormal, and we will call that claudication. Now, whilst there's a lot of things that can contribute to pain on walking around, like arthritis or damage to your limb for some reason, and potentially as we get older and more frail, that we can experience more inhibition to our ability to walk. When it's a bit abnormal, so just a short walk to the shops or down to the end of the street, and we start experiencing severe pain in our legs as if we've been running a marathon, and those things don't match up, that can be an indication that we have some arterial disease, which is fundamentally a blockage or damage to the artery that is narrowing or causing a restriction of blood being able to feed the limb or the tissues and the muscles beyond that point where that blockage is. Okay, so if I have a blockage in my thigh, I might start experiencing pain in my calf muscles. If I have a blockage further up in my body, I might start experiencing general pain in my leg. And we call this pain claudication. And that, again, it manifests when you walk short distances and experience pain a lot like a marathon. One of the other classic traits of claudication is that when you stop and that pain goes away, you can walk and start getting further along before that pain comes back. And that's a classic sign of claudication. Other signs of arterial disease again relate to an insufficient supply of blood and nutrients to the peripheries. So you might see hair loss in an area of your body, say from your knee down or from your mid-calf down, and you might see thickening of the nails of the affected limb because the nails aren't getting enough nutrients, so they become crumbly, hard, and misshapen. We may also see a decrease in muscle bulk or loss of muscle in the affected limb, and you can often see this in a mirror when you compare it. If you see that you're on walking short distances, you're getting pain in that limb, and you look in the mirror and you see that the muscle is smaller, it's indicating that that muscle is not getting sufficient blood supply to keep and maintain its health, and it's also giving you pain when you're walking short distances. So that can often be a giveaway as well. In more severe cases of peripheral arterial disease, you might experience pain in the limb all the time, such as at rest. And that pain may actually become worse when you elevate the leg. If you think about a high pressure hose having a blockage and there being something beyond that point of blockage dependent on the fluid getting to it to keep it alive. And gravity, when our leg is down, is helping that blood get through there. When we elevate our leg, we decrease or drop down the pressure that would be helping or supplanting, sort of helping the blood to get down to the rest of the limb. and that suddenly is taken away by you lifting the leg and you're therefore experiencing more pain. So pain on elevating a limb can often also indicate that the arterial disease is reasonably severe. In the most severe cases of peripheral arterial disease, what we call critical limb threatening ischemia, we will often have tissue loss also associated with that high degree of rest pain. And when we talk about tissue loss, we're talking about wounds, we're talking about ulceration, but they don't often manifest in the classic way that we think about cuts and scrapes and ulcers in a leg. They manifest in a way that seems to be a fair bit more severe. And we're talking about gangrene, we're talking about necrosis, where the tissue dies off and it becomes black and hard. Now, we often see this kind of damage on bony prominences. So that's areas of your body where the bones are close to the surface of the skin. So I'm talking like, if I'm talking about a limb, I'm talking about the front of your shin. I'm talking about your ankles. I'm talking about your heels. And I'm talking about the edges of your foot, sort of where the knuckles would be, or the edges of your knuckles would be if you were comparing your foot like a hand, or your toes, right? So the peripheries where the bones are close to the surface of the skin, and where the bones, if they're in contact with a hard surface for a period of time, push away the blood, and you start having damage to the skin and the tissues beneath that bone, okay? So, and that can manifest either as a wound that doesn't heal, or as gangrene, so black, dead, necrotic skin. All right, and we consider this a bit of an emergency. It's a bit of an urgent state to get things fixed up and sorted out. So in summary, early phases of peripheral arterial disease typically manifest as pain on walking short distances or distances that don't seem quite right for your exercise tolerance. They can also be reflected in hair loss, a thickening of nails, or that your limb is cool and cold. You can see muscle loss in the limb, and in more severe cases, you start to experience pain when even at rest. And in the really severe cases of peripheral arterial disease, we actually see death of tissue beyond the area of blockage, which can manifest as ulcers that don't heal or gangrene. These wounds are often quite painful, and the tissue inside these wounds often looks quite pale and sad and not very healthy or well, and they don't have a trend of getting better by themselves. How do we treat peripheral arterial disease? Well, in the early phases, there is some evidence that walking and exercise can help improve claudication, that pain that you get when you walk around. So that's advised. You can start extending or get longer periods of exercise tolerance by doing more walking, on either pushing past the pain or resting and pushing on with walking to get across the pain. So you'll need to sort of map out your exercise related to that. Obviously, ceasing smoking will help reduce your risk of developing peripheral arterial disease, and also reduce the advancement of peripheral arterial disease if you have developed it. Managing your cholesterol, so speaking with your local family doctor or your general practitioner about getting your cholesterol tested and managing your cholesterol will help reduce the risk of and or advancement of peripheral arterial disease as well. In the more severe cases where we have rest pain or limb-threatening ischemia, such as wounds accompanied with pain or severe wounds, you need to see a vascular surgeon in an effort to manage and treat that disease. In the cases of severe peripheral arterial disease, all is not lost. These days, the technologies are advancing quite rapidly in regards to treatment of peripheral arterial disease, and the vascular surgeons these days can actually undertake a lot of treatment of this disease with what a lot of people think of as keyhole surgery, or what we call angiography, which is where the surgeons make small punctures or cuts into the legs, and they access the arteries via these small cuts, and they can clean out the arteries or place stents in a lot of a manner similar to a modern day plumber, or a plumber in the past has cut away blockages or opened up or replaced sections of arteries to help blood get past the blockage and down to the limb to help get it back to health and back to life again, and clear things up. Only in severe instances of peripheral arterial disease do we need to undertake things like amputation? So where possible, these days the surgeons have a view of limb salvage and are quite aggressive at doing limb salvage. But of course, this all depends upon the nature of your health service, the nature of the health resources that you can access, etc. So obviously, I talk from the Australian experience where we're fairly well resourced for this, but your access to a vascular surgeon and the techniques that they use for this may differ depending on which country you live in and the nature of the resources that you have access to. So to close out, I've spoken today in this podcast about peripheral arterial disease, not veins. Arteries are the part of your circulatory system that supply blood to your organs, your skin, and your muscles, and your brain to keep it all functioning. And when we have blockages, we have death or begin to have problems with the organs that are supplied by the arterial system. The manifestation of arterial disease tends to be related to pain, changes in the skin, and in more severe cases, wounds that won't heal or that manifest as gangrene. And that treatment can range from managing your smoking, doing more exercise, controlling your diet, and more severe cases, seeing a vascular surgeon. Severe cases of peripheral arterial disease are a medical emergency, and the symptoms and signs of them should not be ignored. They should be dealt with in a timely and rapid fashion. Thank you very much for listening to my podcast, and I look forward to speaking to you more in my next podcast about venous disease and the way that manifests.